And I didn't think I would be of any use in a wartime hospital because, frankly, I expected young men to be the predominant patients. But I can tell you, in one day during my service at the hospital, 4 out of 5 patients in our resuscitation or code room were children under the age of 16. It is staggering. It is a staggering failure of humanity that I witnessed. The Al-Aqsa Hospital is one of the only remaining functional or semi-functional hospitals in the central Gaza Strip. It was when we arrived approximately 2 weeks ago. Our team is a combined team of clinicians, myself included, physicians who are there to treat and serve the population that is currently being bombarded and in an area of active conflict and in a very volatile area. And so that significance of that hospital became very clear to us within the 2 weeks of our stay, where we initially saw it to be a somewhat functional hospital. And within the next 2 weeks, because of increasing bombardment and increasing volatility and safety and security concerns, our emergency medical team was forced to evacuate the hospital and could no longer work there, rendering thousands, hundreds, if not thousands, of patients and families without access to health care. What we're seeing in this conflict, which is so specific in this context, we're talking about now the fall of hospitals. We're estimating, when will the next hospital fall? That is around related to several factors, one of which is, of course, safety, security, bombardment. But what we're also seeing is that the hospitals are seen as safe havens, as they would be in any other war. So you're seeing families shelter there, doctors' families. It's not uncommon to see people staking out their territory on a little space in a blanket in the middle of the emergency room, because there is no place else that is safe in Gaza right now. So people are just hedging their bets that this one will be. And then by the end of 2 weeks, we saw that physicians and nurses had been displaced multiple times over, forcibly displaced, and were unable to come to the hospital. I think the most poignant thing I recall, and I'm kind of processing at this time, is the lack of pain medicine, not allowing for a dignified death, specifically around children. I witnessed children die without pain medicine because of traumatic amputations, because of severe burns due to explosives. There is no way, there is no system on this planet that can manage the amount of mass casualty that these hospitals are seeing at this time. As a pediatrician, I didn't think I would be of any use